Mental illnesses, according to health specialists, are conditions involving changes in emotions, thinking or behavior in human beings. Many a time, mental illnesses have been associated with distress, trauma, or problems functioning in social work or family activities. In December 2016, a Directorate for Non-Communicable Diseases and Mental Health was established within the Ministry of Health and Sanitation in order to coordinate services and oversee partner mental health activities. The Directorate is in the process of drafting new mental health legislation with the hope of protecting the human rights of people living with mental illnesses. In relation to this, regional consultative meetings are ongoing in the country. Dr. Santigi Sise is the Director of Non-Communicable Disease and Mental Health in the Ministry of Health and Sanitation in Sierra Leone. He started explaining on the essence of the consultative meetings.
To actually discuss issues around the strategic plan and policy of mental health. Currently we are working on repealing the 1902 Lunacy Act, and for you to repeal an act, you need to have a policy that will guide you on the process. So last week we were in the south and the east, and this week we're in the north. Today we're in Port Loko, where we have participants from all the districts. We have from Tonkolili, we have from Koinadugu, we have from Falaba, and from Bombali. So we're here today to look at the document and have the views of other people, which we'll put together that will inform us on what we're going to do.
What impact this mental health policy will bring into the country? Dr. Santigi Sise again.
I think it will mean a lot, because it's a policy will always kind of guide us as a country and as a people on how we want to go in terms of addressing mental health issues. We know mental health is a social issue, but we as a ministry are very much concerned with the health impact of or the health consequences of mental health. So we are working towards addressing the main issues. For the social component, I'm sure other ministries, departments are working on that. But at the same time, we collaborate with all of those ministries. That is why you see in this meeting, we have the Minister of Social Welfare represented, we have the police here represented, we have other line ministries represented. So we're working as a team to ensure that we get things right.
However, Kush has been one of the mostly consumed narcotic drugs in Sierra Leone, which is currently contributing to the mental health disorder of youth within the ages of 15 to 35 years. So what is the Ministry of Health doing to curtail its importation into the country?
Well, the issue of Kush we know is a problem, but honestly, as a Ministry of Health, we will not actually talk much on how it is prepared or how it is coming to the country. I think what we are very much interested is in how we'll be able to rehabilitate those who are using the substance, especially when they end up developing mental disorders. So that is why, in fact, you see that government has taken it to be a very serious issue, and of course, government has established a mental health task force, and also government has also employed a mental health advisor to His Excellency the President to ensure that we're able to address all health issues related to substance abuse or use of substances or misuse of substances.
Though mental health treatment has been a challenge and has a treatment gap of 98%, what the Ministry of Health is doing in mapping out sensitization strategies about Kush.
Sensitization is a process. It's not a one-day issue. Kush or without Kush, we always sensitize our public on mental health issues. The fact is, maybe Kush can just serve as a trigger, but almost all of us have some mental health issues. If we're not able to control our emotions, we're not able to control ourselves when they are depressed, definitely it can trigger mental disorders. So it's a process, so we continue to sensitize the public, we continue to have radio discussions, television discussions, community meetings, town hall meetings. Each time we have those opportunities, we talk to our people to be aware of mental health issues, especially knowing that we've gone through a 12-year rebel war, we have the Ebola outbreak, we have COVID and a lot of other issues, the MOHS that was there. These are all factors that contribute to mental health disorders.
During the consultative meeting, I met with a clinical psychologist who doubles as the head of department clinical psychology at the University of Makeni, Dr. Rebecca Islika. What this means to her?
Well, it gives me hope that finally it seems that governments want to own the mental health program in this country. Calling consultative individuals to consult on developing or renewing the strategic plan and policy making, I think it's a good sign. It's a positive sign going to the right direction, and it's going to mean a lot on the respecting the human rights for our people that are mentally challenged in this country, and also respecting their needs and trying to provide to really actually focus on the problem itself. See what can be done to reduce the treatment gap in this country, because the gap is there, and if all our recommendations are taken into consideration and implemented, I think the country is going to a positive area to address this mental challenges problem that we have in the country.
She further said, though there was not much interest in addressing mental health, but with the mental health policy, there is hope to end mental illnesses in Sierra Leone.
There was no interest to address the issue itself, but now with having a strategic plan, with having a policy, with having legislation being renewed and challenged, it's going to be slow, but this is the right direction we are taking right now. For me, it gives me a lot of hope for the future for mental health in this country.
Sierra Leone Psychiatric Hospital remains the country's only inpatient facility, treating up to 150 patients at a time, and it's highly stigmatized and suffers from chronic underfunding, limited human resources, and a lack of basic facilities and frequent interruptions to medication supplies. This often results in restricted treatment options and the chaining of patients. However, this dire situation is now starting to improve with the support from international partners. Sierra Leone continues to use the outdated Lunacy Act of 1902, which is highly discriminatory. Reporting from Sierra Leone, West African region, I am Yusuf Mosire Suma.